Hi, I am Dr. Shirley Mathan, Lead Senior Consultant, Women's Health, Aster MedCity. Today I want to talk to you on cervical cancer and its treatment. Cervical cancer is a slow growing disease. Since it has a precancerous stage, it helps us to detect it at the early stage, or it can be prevented by early screening and helps us in the treatment of the cancer cervix. All ladies has to undergo screening from the age of 20 years or when they become sexually active. So, periodic screening will help us to discuss any precancerous stages that can be appearing in the cervix. If any precancerous stages like ASCUS, LSIL, HSIL, all these can be detected and the treatment can be given appropriately. Conditions like ASCUS, all that appear due to infections. So, the infection has to be treated and a repeat pap smear has to be taken to document the disappearance of these conditions. The others has to follow up through the periodic screening. So, if you detect any high grade epithelial changes, or these changes can be combined with the HPV screening test. HPV, if detected with the strains that will cause cervical cancer, then they have to be treated or followed up more aggressively. If HPV infection is negative, we can relax a little bit on the screening process. These pre-malignant conditions, if left alone, most of them will regress on its own, and if they are progressing to malignancy, it is going to take a very long time, maybe as long as 20 to 30 years. So, we are getting a very good window period to follow up and detect and treat the disease. In the pap smear, the other diagnosis is CIN1, CIN2, CIN3. CIN1 is the low grade tumor or the cancer. Here, without any treatment itself, 90% of the time it regrets on own. Only a very low can progress to CIN2 or CIN3. In CIN2 and CIN3, the regression is more and the progression can happen in like 80 to 90%. So, these people need more follow up and treatment. So, what are the treatments you are going to offer them? It depends on whether they want to conserve their fertility or not. If they want to continue to have family or to have more children, then we will have to give a conservative treatment. So, those people with CIN2 and 3, they may need a cone biopsy or a biopsy, colposcopy directed biopsy will help us to detect what is the stage or whether they need more treatment or not. In CIN2 and CIN3, periodic staging, if showing that it is persisting, then you can combine with the HPV testing. If they are positive for strain 16, 18 and other strains causing malignancy, then they have to be treated. So, if they want to preserve or pertain their fertility, the treatments offered are cone biopsy, colposcopy directed biopsy, radical trachelectomy, etc., so that the uterus is preserved and a future pregnancy is possible. But in those people who are completed the family or who are little nearing menopause, if you make a diagnosis, you can discuss with them and think about a simple hysterectomy. So, these are the pre-malignant conditions which are possible to completely cure them or prevent them. So, when you go to the further, when there is a definitive cancer, we have to stage them. The staging will help us to decide what type of treatment should be given. So, when they stage, clinical examination is done, and to help us in staging, other investigations like ultrasound, CT scan, MRI and PET scan, all these together put together, we can make the staging proper. So, the staging is very, very important, as if you have not staged properly, the treatment also will vary. Let us look at the treatment for stage 1 and stage 2A. These two stages can be completely cured with a hysterectomy. So if there is spread to the lymph nodes, we have to do a pelvic lymph node dissection too. If there is involvement of the parametrium in these when the report comes, only then we have to think of the radiation and the other chemotherapy. In people diagnosed with the stage 2B, 3 and 4, there is no role for surgery. They have to undergo radiotherapy, both external radiotherapy, brachytherapy and chemotherapy if needed. When there is extension to the pelvic wall, definitely chemotherapy is required. Drugs like cisplatin and are used for this chemotherapy. Cancer cervix is a preventable disease. By early screening, we are able to prevent most of the disease. If you educate the people that they need a proper screening and come periodically to the hospital, then we are able to do a good job. And since it's preventable, I think all should go periodically to the hospital for the pap smear and the early detection of cancer cervix.